Now, for the next introductory video, we are going to look at is the general concept of central nervous system pharmacology. So, central nervous system pharmacology is basically you trying to build on the knowledge you previously got from physiology. Okay, so this one now you are going above just trying to learn about the structures that make up the central nervous system, but you are going to look at, okay, disease conditions could occur in the central nervous system. So how can we be able to use drugs? Okay, how can we use drugs that mimic the neurotransmitters that you learned in physiology? I don't know if you understand. So you are basically trying to step your knowledge in this area. So this is the central nervous system, and of course it's divided into the parasympathetic nervous system and also the sympathetic nervous system. All right, so this makes a very nice introductory basis. So you should know that if you look at the CNS pharmacology, it studies how drugs can be able to act in the central nervous system that is made up of the brain and the spinal cord. So of course this is the area that controls how you think. So drugs can be able to change how you think, control your emotions. Drugs can be able to control how you feel, control your movement, and also vital functions. So CNS integrates signals from the entire body. So if you put a drug in the central nervous system, it can just affect everywhere. You understand? So why do we actually even study this central nervous system pharmacology? This is because we want to know the central nervous system better and also its functions. We want to also know about disease conditions that will affect the central nervous system, like depression, epilepsy, Parkinson's disease, schizophrenia. Okay, then we also want to know about the different categories of drugs that can be able to act on the central nervous system: the analgesics, the sedatives, the antidepressants, the antipsychotics, the anticonvulsants, the stimulants. We want to now know how these drugs are able to act on the central nervous system. Okay, so key principles that we'll look at here is we'll get to study the blood-brain barrier, okay, getting to talk about how some drugs can be able to cross the blood-brain barrier and how some cannot be able to. We'll also get to study the neurotransmitters, okay, that's the natural neurotransmitters: dopamine, serotonin, norepinephrine, acetylcholine, GABA, glutamate. Of course, these neurotransmitters, they give the basis or the intelligence to why some drugs we use today have been developed. So we'll talk about the balance of excitation and also inhibition of the nervous system. So major categories of drugs that could actually act on the central nervous system, just trying to talk about it on a glance. We have sedatives and hypnotics. These are drugs that could actually reduce your anxiousness and actually cause you to sleep. We have antidepressants. These are drugs that will basically take away depression from you and enlighten your mood. We have antipsychotics. We have anticonvulsants that take away seizures, epilepsy. We have analgesics that take away pain. We have stimulants, okay. And all right, so these drugs, some of them, they actually give some good feeling. So people kind of like abuse them just to get away from their immediate situation. But drug abuse is not justifiable, right? So we'll talk about all those aspects as we keep going on.